PRP stands for platelet-rich plasma. So in our blood, we have red blood cells, white blood cells, platelets, antibodies, proteins, fluid, all kinds of different things. And the platelets are those things that when you cut yourself, you form a scab. They come in, they form a scab, and they stop the bleeding, so you don't bleed to death. So that's very important. If they just formed a scab there and they stop the bleeding, well, how are you going to heal? Well, the way you heal is the platelets have growth factors. So they form a scab, they release those growth factors, and those growth factors stimulate new blood vessels and cells to come in the area to help it heal. So we've known for years and years and years that platelets have healing growth factors. And even in the 70s, 60s, 70s, 80s for sure, people started using originally for dental, then for ENT, ear, nose, and throat, and then for plastics, and then eventually for musculoskeletal orthopedics, uh, the patient's own blood by taking some blood from a vein in the arm, and usually it's not as much blood as you would give for a blood donation. So a blood donation is about a pint, 300 cc's. Really, it's about 60 cc's. Sometimes it can maybe be up to 120 cc's of blood. So it's not a huge amount of blood that we draw, but we take that blood and then we put it into a centrifuge, which is kind of like a washing machine. It spins it spins around really fast. And then the red blood cells, the white blood cells, the platelets, the fluid, the protein, they all have different weights. So they'll separate out based on their weight, and the platelets separate out into this nice little white layer called a buffy coat, if you want to get technical. But we're able to separate the platelets out, and now they're very concentrated. So you have concentrated platelets, which means concentrated growth factors, which I like to use the analogy. It's kind of like Miracle-Gro. It's like fertilizer, but it's really strong. So it's like Miracle-Gro. And then we take the platelet-rich plasma that we concentrated and we inject it into the area where there may be an injury, like a sprain, an injury to a ligament. There might be a strain, an injury to a muscle or a tendon. Those are kind of more acute or more recent, or it might be something chronic like arthritis. It might help with surgery. If we have a surgery and we repair a meniscus cartilage, it might help that heal. So it's basically growth factors that are supercharged and concentrated, kind of like Miracle-Gro.